My name's Dr. Sarita Robinson and I'm a Principal Lecturer at the University of Central Lancashire, and the course that I'm going to be talking about is the course on stress. So what is stress? Now, loads of people say, I'm stressed, I'm really stressed today, I'm totally stressed, I'm stressed out of my mind. But what do they actually mean by that? It's really, really hard to define stress. It might be easier to talk about how we respond to different stressors, but then that's still quite difficult because stress is really subjective. What's stressful for one person, for example, a great big spider in the room, isn't stressful for another person. That person might actually quite enjoy having spiders around. So that's one of the main barriers to describing stress, the fact that it's so subjective. I mean, one of the things that I really enjoy doing is stand-up comedy. I like standing in front of an audience and telling jokes. For other people, that could be classed as one of the most stressful experiences of their life. And there's also this other assumption that we have, that stress is really bad for you, that being really stressed is a really negative thing. Whereas actually, if we didn't have any stress in our lives at all, we probably wouldn't do anything. So think about, I don't know, an exam that's coming up soon. If you weren't stressed a little bit about that exam, you might not do anything to prepare for it. You might not have the motivation to do your revision, to even be watching this video cast. You might not do anything at all, in which case you'd get to your exam and you wouldn't have the knowledge in your head ready to pass that exam successfully. So we shouldn't automatically assume that stress is bad for us. Sometimes it can be a really good motivational tool. However, there are times in our lives when stress can become overwhelming. We start to feel that we can't cope with certain situations, and that can have a really negative impact on us. Not only on us sort of physiologically, so we might start to feel our heart racing, etc., but also psychologically we can get high levels of anxiety and start to feel, like it's not something we want to be doing. We just want to crawl into our beds and stay there. So we really do need to see how to define stress. And one of the things that we could do is just look at different types of event. We could say, do you know what? Everybody finds moving house stressful, or everybody finds doing an exam stressful, or everybody finds the death of a spouse stressful. There are some events where we could say, yes, they are very likely to be stressors for the majority of people. However, as I said before, it's important to remember that sometimes it is subjective and that some people might not find what you think is stressful as stressful. So how are we going to sort this out? Well, one of the things we could do is define it into two different groups, and they can be then classified as acutely stressful or maybe chronically stressful. So what do we mean by an acute stressor? Well, an acute stressor is something, whatever it is, that causes us a very sudden, sharp response. Yeah, and that response can be quite physiological. So our heart can start to beat faster, we might sweat, we might breathe more heavily because we've seen something in our environment that has triggered that threat response. So one really simple acute stressor might be you're walking down the road, you're about to cross out the road, and suddenly a car appears from nowhere. It gives you that very quick shock. You perceive the threat, and then as soon as it started, it's over. The car's driven away, you weren't hit, you have recovered, you've made it safely over to the other side of the road, and all is well. But for that few minutes, you had an acutely stressful event. The other type of stress that we might experience is chronic stress. So with chronic stress, what we actually have is an ongoing stressor. So this might be some horrendous situation that's going on for months and months and months, such as being bullied at school, or living in some really horrible housing, or losing a job and not being able to get another job. So people in those situations are experiencing chronically stressful environmental factors. And this can mean that the situation isn't resolved quickly, and all those physiological responses, so the increased heart rate, the sort of sweating and being sort of fairly agitated, just goes on and on and on over a long period of time. So there we have two types of stressor. We have acutely stressful events and a more long-term chronic stress. So the question is then, why would we research this area? And more importantly, how can we research this area? Well, let's start by looking at the benefits of sort of looking at stress. Why would we investigate it? Well, one of the reasons we would investigate it is to try and find out what triggers stress responses in people, and then more importantly, the interventions that we can put in place to stop people feeling stressed. So we all know there are some really annoying people who are like totally immune to stress. They seem to wander through life totally relaxed all the time. And we say that they have good resilience. And one of the things that we can do as stress research is try and work out exactly what it is that causes them to be more resilient than other people. The other thing that we might be able to do is design training or help people develop coping strategies that mean that they can cope better in acutely stressful or chronically stressful situations. Now, in my area of research, I look at people in life-threatening situations, and my research is really trying to work out interventions that can help people overcome the stress that they're feeling and put into place behaviours that are going to help them to survive. So, for example, I'm interested in people that are trying to rescue others from fires, or people who fly over water and might be involved in a helicopter crash. And to do this, ethically and practically, I can't look at people in real life situations. You can't just go and predict when an emergency situation is going to happen, and two ethics committees get really upset if you've got somebody, I don't know, who's floundering in the water in a real life crash situation and you try and give them a questionnaire. It doesn't happen. So what we need to do is look at how we measure people's responses to stressful situations in an ethical and practical way. And so what I do is I use simulator training. So I get people who get into a mock-up of a helicopter, it's suspended over a pool, and then it's simulated as a crash response. And so what we call the Hewitt will dunk into the water, and then we will look to see how people respond. And I can ask people questionnaires or take physiological measures in more controlled environments. And the reason I do that is because I want to know what improves the training so that people feel less stressed in that situation and more able to cope, and how we can improve the design of things like safety equipment, so when people are really stressed, they can use them effectively. Now, obviously, not everybody does research into stress in real world situations or using simulator training. Some people do research into stress in the labs. So how do you get people to be stressed in a sort of lab environment? Lots of different approaches have been used. We can show people horror films, so we can spook them out with scary movies. We can also give them maths papers. Maths anxiety is a good one, so getting people to do really complicated maths exams. Or we can ask them to undergo some physiological pressures. One of the ones that's commonly used is called the cold pressor task, and this task people put their hands and arms, upper arms, in ice cold water to see how long they can keep it there, and that can get people quite stressed as well. But one of the most used stressors in the lab environment is something called the TRIA social stress test. So the TSST was developed by Clemens Kirschbaum at Trier University in Germany. And this is a task that has two parts, and it really taps into something called social evaluative stress. And that's the stress that we feel when other people make judgments about us. So in this situation, we would have people either giving a 5-minute presentation about a job interview. So they're asked to present to a panel of really unsympathetic people why they should get a job. And in the second half of the TRIA social stress test, they're asked to count backwards from a 4-digit number like 9,392 in a set amount such as in sevens. And every time they make a mistake, they're asked to go right back to the beginning and start again. They're told that their responses are going to be videoed and then they're going to be analysed to look at their body language. So that really does elicit stress. For chronic stressors, we would probably have to use a more naturalistic environment and maybe look at people who are living in situations that cause them a large amount of stress. That's because it's not really ethical to put people in chronically stressful environments for a prolonged length of time.